How to get a passing score on OET speaking. Hi, my name is Morris and I have been an English tutor for the past 25 years. In this channel, we focus on OET speaking preparation for doctors, and today we're going to see another sample for you. Remember that this is just a sample for the speaking test, so feel free to change, to adapt when you are preparing for your exam. Before we start, remember to subscribe to our YouTube channel, like this video, and share it with everyone you know. So this is today's role play card. Setting: private clinic. Doctor, you're talking to a 35-year-old woman who has recurrent urinary tract infections. She believes the recurrent UTIs come from her lifestyle, hiking, gym, coffee, and has come to you to inquire about surgical management of UTI, as she is fed up with constant UTIs that disturb her lifestyle and daily activities. Tasks: collect information on patients' habits so as to determine the cause of the UTI. Ask about the patient's regular day, routine, exercise, shower time, how much water she drinks, and what else she drinks. Reassure the patient that hydration and good hygiene are sufficient to avoid future UTIs, and surgery is ill-advised. Encourage the patient to improve her hygiene and check in a review if this brings benefits. The surgery can be discussed if there are no improvements. So let's start with the sample role play. Hi, Clara. Welcome to our health center. I'm Dr. Martin, one of the physicians here. How can I help you today? Hello, doctor. Over the past year, I've been dealing with recurrent bladder infections. I'm not sure if it's something to do with my routine or habits, but it's really affecting my quality of life. I also came across some information online suggesting there could be surgical treatment options, and I'd like to know more about that. I appreciate you bringing this up, Clara. Before we explore any surgical options, I'd like to ask you a few questions to get a clearer picture of your overall health. Is that okay? Of course, go ahead. Wonderful. Let's start with your daily routine. Can you describe what a typical weekday looks like for you? Sure. During the week, I usually go for a swim early in the morning, then head straight to work. I get back home around 7 p.m., and I usually take a shower before dinner. But on really busy days, I sometimes skip it and only shower the next morning. Got it. And how much water do you typically drink in a day? Not much, to be honest. I usually just have one bottle of water while I swim in the morning. Do you consume other beverages during the day? Yes, I do. Mostly coffee at work and sometimes soft drinks or iced tea with meals. Thank you for sharing that. Clara, staying well hydrated is a key factor in preventing bladder infections. I'd like you to start drinking more water throughout the day. You can use the same bottle and aim to refill it at least 3 times: mid morning, mid afternoon, and evening. That should bring you to about 2 liters daily. Does that sound manageable? Yes, I think I can do that. Excellent. That's a strong first step. The next part is just as important. I strongly recommend you shower immediately after your swim. This helps minimize bacterial growth and reduces infection risk. Is that something you're willing to adjust? Well, I'm not really comfortable using the public showers at the pool. They're not very clean and it makes me uneasy. That's totally understandable, Clara. But you also mentioned that these infections are taking a toll on you. Hygiene after exercise is crucial. If the showers at the pool aren't an option, Perhaps you could plan your swim so that you can return home right afterward to shower before heading to work. Would that be doable? Yes, I think I can rearrange my schedule a bit to do that. Great. Now, regarding surgery, here at the center we follow a conservative approach. Surgical intervention is considered only in persistent or more complicated cases. I'd like you to try these lifestyle adjustments for the next 4 weeks. After that, we'll have a follow up appointment. If your symptoms haven't improved by then, we can discuss further options, including surgery. Does that make sense? Yes, it does. Is there anything else you'd like to ask or clarify? No, I think that covers everything. Thank you. You're welcome, Clara. I've scheduled your next appointment for a month from now. In the meantime, feel free to contact us if anything comes up. Take care and have a great day. Thank you so much for watching today's video. Now, are you ready to boost your confidence for the OET speaking test? You can book a free 25-minute trial lesson with me and experience personalized feedback, role-play practice, and expert strategies tailored to healthcare professionals. To book your free session, simply send an email to morrisoet@gmail.com. Don't miss this opportunity to take the first step towards your OET success. Thank you so much for watching today's video. Subscribe to our channel, like this video, and share it with everyone you know. Have a fantastic day, and I'll see you next time.